Have you ever stopped to think that something silent could be happening inside your body without you even noticing? Imagine a disease that causes no pain in the beginning, shows no clear signs, and when it is finally discovered, it may already be too late. That is exactly what happens with prostate cancer. What many people don't know is that the symptoms exist, but they are so subtle that most men simply ignore them. Today, I'm going to reveal the 8 most silent warning signs that could indicate this problem, and the last one is the most common, yet also the most overlooked. Did you know that 1 in 8 men will face prostate cancer at some point in life? It is the second deadliest type of cancer among men, and the worst part is that it progresses silently without showing clear signs until it's too late. But how can you protect yourself before it's too late? Stay with me, because today I'll share the 8 most silent warning signs, and the last one is the most common. Unfortunately, many men discover too late that they are facing this silent threat: prostate cancer. This happens because, being a discreetly evolving disease, it often goes undetected until it reaches advanced stages, when treatment options are more limited and chances of cure drop drastically. But here's the good news. This is one of the types of cancer where we can make a significant difference, as long as we act with knowledge and speed. If we can identify the symptoms early and seek proper medical attention, survival rates are surprisingly high. In fact, 9 out of 10 men who act quickly are able to overcome the disease. This is a message of hope that reinforces the importance of being informed and attentive. Although science has not yet fully unraveled why some prostate cells turn cancerous, it's already known that certain factors increase the risk, the main one being age. From age 50 onward, the chances of developing the disease rise considerably. Before we start, I'd appreciate if you liked this video. It helps me keep spreading health and information. If you like it, comment with the number 1. If not, comment with the number 0 so I can improve future content. Now let's get into the symptoms. One of the first warning signs is increased urinary frequency, known as polyuria. Normally, urinating 6 to 8 times a day and at most once during the night is considered healthy. However, when the prostate begins to enlarge, whether benignly or malignantly, many men notice a significant increase in urinary frequency, especially at night, which is called nocturia. Another common sign is urinary urgency, that sudden, uncontrollable need to urinate, which can be uncomfortable and even interfere with daily activities. In addition, it's not unusual to feel as if the bladder has not been completely emptied, which can be frustrating and cause constant discomfort. A symptom that often goes unnoticed is the body's difficulty in distinguishing rectal pressure from stool versus pressure caused by an enlarged prostate. This can create a sensation of incomplete bowel evacuation, which many men mistakenly attribute to digestive issues. In more advanced cases, the situation can lead to urinary incontinence, where urine leakage becomes uncontrollable, affecting not only physical health, but also quality of life and personal confidence. These signs, although they may seem minor at first, are alerts that should never be ignored. Each one of them invites us to pay closer attention to our health and to seek professional help preventively before the symptoms progress. A less common symptom in early stages, but one that deserves special attention, is lower back pain. This usually appears when prostate cancer has advanced and spread to other organs. Prostate cancer has a marked tendency to metastasize to the spine and other bones, causing deep, intense pain that often does not improve with rest or common painkillers. In fact, this pain tends to persist and, in some cases, may even worsen at night or when lying down, disrupting sleep and significantly affecting quality of life. It is important to emphasize that this type of pain is not like the typical discomfort caused by poor posture, muscle injuries, or natural aging. It is an unexplained, constant, and progressive pain, making it a critical warning sign that should never be ignored, especially in men over 50, Many only discover they have prostate cancer after it has already spread and symptoms have become severe. Among the most alarming but often underestimated symptoms is the presence of blood in the urine, hematuria or semen hemospermia. These signs can cause distress and confusion since there are many possible causes, some benign such as urinary infections, kidney stones, or even minor trauma. However, it is crucial not to ignore that both hematuria and hemospermia may indicate much more serious problems, including cancer in the urinary tract or prostate. The color of urine can also be an important indicator. If it appears reddish, pinkish, or brownish, it could signal that something is wrong. Although sometimes these changes can be caused by foods like beets or certain medications, the presence of blood in urine should never be considered a coincidence. It is always a reason to seek medical advice and ensure that early diagnosis is not a missed opportunity. As for blood in semen, although in some cases it is linked to infections, prostate inflammation, or prior procedures such as biopsies, it can also be a sign of something more serious. It is essential to remember that any change in the color of urine or semen should be taken seriously and evaluated by a healthcare professional to rule out major issues. Another important warning sign is unexplained weight loss and constant fatigue. These occur because the body is using excessive energy to fight the disease, while cancer cells consume essential nutrients. While weight loss and fatigue can be related to other conditions such as stress or metabolic issues, they should not be ignored, especially if persistent or progressive. If you've ever felt burning or pain while urinating, don't ignore it. This can point to prostate-related problems. An enlarged prostate can compress the urethra, making it difficult for urine to pass and causing discomfort. In more serious cases like prostate cancer, this discomfort may become more intense and persistent, often accompanied by other symptoms such as frequent urination or the sensation that the bladder has not been fully emptied. Another significant symptom is painful ejaculation. Although often linked to infections or prostate inflammation, it can also be an early sign of prostate cancer. The pain may feel like pressure or discomfort in the pelvic area or urethra, sometimes radiating to the testicles or lower back. This symptom not only affects physically, but can also cause emotional impact, leading to anxiety or discomfort in sexual relationships. If pain during ejaculation is accompanied by other symptoms such as urinary changes or lower back pain, it is essential to seek medical evaluation as soon as possible. Early diagnosis increases the chances of effective treatment, less invasive procedures, and better long-term quality of life. Finally, unexplained weight loss and severe fatigue are signs that should never be underestimated. In advanced prostate cancer, the spread of malignant cells can severely affect the body, disrupting its overall function. Fatigue is not simply feeling tired. It is a profound sense of exhaustion that does not improve with rest. This lack of energy, when combined with unintentional weight loss, can be an indication that cancer is interfering with essential body functions. If you are experiencing these symptoms, it is crucial not to ignore them and to seek medical care for an accurate diagnosis. The earlier the underlying cause is identified, the greater the chances of successful treatment and the prevention of serious complications that could compromise your quality of life. If this topic seemed interesting to you, don't forget to share this information. See you next time.